It's been a bad year for measles in Canada. We're talking about numbers we haven't seen in around 30 years. And as we've been watching the number of cases rise over the past couple of months, I've been asking experts why.
There is misinformation out there.
There's a lot of misinformation out there about measles vaccines, about vaccines in general.
Lots of misinformation and distrust in institutions.
Trying to counter all of the vaccine misinformation, that is a bit of a game of whack-a-mole.
Medical professionals told me that there are a lot of theories out there that just are not true, and that misinformation spreads like wildfire online.
Did everybody get the measles?
Yeah, back in the day, it was kind of normal to get it.
Yeah, it wasn't no big deal.
The idea that catching the measles is no big deal or that getting natural immunity is better is just not true. Rebecca Archer knows this firsthand. Her daughter Renee died of the measles.
The fact that it was measles, I just couldn't get my head around it.
Renee was infected as a baby when she was too young to get the measles, mumps, and rubella vaccine. She seemed to recover, had no other health issues, but the virus was laying dormant in her brain for years. When it became active 10 years later, it caused seizures, left her unable to talk, to eat, even stay conscious.
They told me that it was going to be fatal.
Renee had a measles complication called subacute sclerosing panencephalitis. It's a very rare complication, but other complications are more common. Serious ear infections happens to 1 in 10, so does a pneumonia. Encephalitis, that's when your brain swells, that happens to 1 in about 1,000 people with measles. And measles can be deadly. It can kill between 1 to 10 per every 10,000. There can also be long-term consequences for those who do survive a measles infection, like loss of hearing, blindness, or muscle weakness. Immunologists do say that surviving measles does give you natural immunity. It's just that you have to get sick first, and that can be incredibly dangerous. And doctors say there's a much safer alternative, the MMR vaccine.
Measles vaccines have saved more lives than any other vaccine we have because a measles infection is incredibly dangerous.
The doctors that I spoke to said that because we've been so good at stopping the spread of measles with the vaccine for about 30 years, a lot of Canadians have just forgotten how devastating measles can really be.
If we do a really good job at preventing something, people don't understand why we're doing it. Because why vaccinate if there isn't any measles?
We know that 2 doses of the MMR vaccine are exceptionally effective, about 97% effective at preventing measles. And even if a vaccinated individual contracted measles, their symptoms are a lot milder and the transmission risk drops significantly.
What would you like to know about the measles outbreaks in Canada? Let us know in the comments below.